Okay?
Okay.
So tomorrow, actually, he starts on a liquid diet before surgery.
Yep, you'll do the ice cream, the yogurt, the pudding, nothing red, blue, or purple. They tell you that.
No.
You know, there was instructions, I didn't see that, though, red, blue, or purple.
Yeah.
What is red, blue, or purple?
Like no,
Blueberry shakes.
yes, no blueberry shakes, no strawberry flavored. It can be strawberry flavored, it just can't be red. Because what it does is it, like, you know how like if you spill wine and it dyes your skin purple?
Mm-hmm.
That's what happens in your esophagus. So when they take out that piece of your esophagus, and right then there the pathologist looks at it. They look at it and it's bright purple. So they think either A, you have some kind of issue that you're not getting blood to that tissue, so they don't know how they're going to reattach you, or B, something really odd is going on, and it causes this huge alarm, and here it's because you drank a glass of wine or you had some purple Kool-Aid, and it ends up being absolutely nothing. So to keep the transition smoother, nothing that's going to look like blood.
Okay.
Yeah, because they'll be calling you like,
Blue.
yeah, they'll be calling out like, did he drink any purple Kool-Aid? So,
Okay, that's good to know.
Yeah.
The
Yeah.
cherry Coke, no.
yeah. You could probably do cherry Coke. Carbonation probably isn't going to be the best thing, just because and especially after surgery, because it's going to bloat you. And you're going to do 5 to 6 small meals a day for the rest of your life. You're pretty much going to be constantly eating all the time. Because if you eat too much, it stretches out the remainder of your stomach left, or it can herniate it through your diaphragm, which is the muscle that separates your stomach from your chest wall. It'll push back up in if it gets too full, because now your esophagus will all be stomach tissue, so it naturally expands. It's shot. So it'll stretch, and sometimes it'll stretch above your...
I have an EUS done.
Do I have your
Yeah.
Endoscopic
She
ultrasound.
did. Marie's having a really... She wasn't able to get it.
Okay.
Mars away.
Okay.
I just talked to this morning.
Alright, just want to make sure.
Yeah.
When did you finish your chemotherapy? What day? Do you remember what day it was? Approximately.
August 3rd, 12th?
August, yeah. August 10th, I think.
Did you have radiation also, or just when did that end? Same day?
Same time.
About the 16th.
And they about started about the same time?
Yeah.
Okay. And they started in...
Beginning of July.
That sounds about right, 6 weeks. Okay. Alright.
So the endoscope, he'll have the morning of the surgery, the endoscope.
Always.
Always.
Okay,
They always do one in the middle of it. They can get out. Just get a happy feeling.
okay,
It's kind of like walking around the ballpark before the game starts.
okay.
Yeah.
Okay.
Thanks, sir.
But look down your esophagus and down into your lungs.
And into my lungs?
Make sure everything looks nice and clean. But yeah, like I was saying about the stomach, because your esophagus is going to be stomach tissue, probably up to about here, and your diaphragm's here, it'll stretch above it, and they have to go in and redo surgery. And that's a big deal. Like, it's a big deal, so to say, is it's always a big deal after you've had one big surgery to go back in, because you're going to have scar tissue, which is normal, but it's just a bigger deal, and it's harder to always recover when you go in somewhere that's already been operated. So 5 to 6 small meals a day. That's the biggest thing. She'll be eating all of them. Eat like it's Thanksgiving every day. Like, just pick all day long.
Sounds good.
Any other questions?
Fluids with a meal, I read in one of those handouts, when you have a meal, you should drink no more than like 4 ounces of fluids with that meal.
Yeah, when Dana comes in and talks to you, she usually recommends you don't do any fluids and food together.
Oh.
Because it's going to bloat you. That's why we don't recommend carbonated beverages, because they're going to bloat you. Like, unfortunately, beer is going to bloat you. I have one patient who, he's in his 60s. He's a trip. He's like, I had a beer and I had 2 beers. And then I couldn't eat anything for hours, because, like, he was so uncomfortable, because your stomach's only now this big. And it bloated him so much. And his wife's like, I told him, he drank it. I ignored him. Told him if he wants a drink a drink with, like, fruit juice. And him and his son were sitting on the beach and had a couple beers, and he was miserable. And you'll learn that about yourself. Like, some patients can't do sweet stuff after surgery, like, at all. And sweet stuff can give you dumping syndrome, because your stomach's smaller and it goes through quicker, give you diarrhea. If you eat a lot of food, you get dumping syndrome. You'll learn. It's going to be kind of trial and error. And if you get a lot of diarrhea after surgery, call me or call Marie. because sometimes you can get an infection in your gut called C. diff. We'll test your stool for it and see how that goes.
How long after surgery are you talking?
Usually if you get C. diff infection, it usually happens within the first 2 to 3 weeks.
Okay, this will still be here then.
Yeah, and that's what I was going to say. That's what we recommend you stay here for a minimum of 2 weeks after surgery. Because a lot of our patients will go home, and then they call me like, Amy, A, B, C, or D's happening. I'm like, well, you know what? You're in New York. I can tell you your ER, then they're going to have to transfer you down here. Like, I can't do anything else. You have to get stabilized, and then we'll get you here. And they're like, oh, you're kidding me. I'm like, that kind of my hands are tied, and a lot of outside places don't use our feeding tubes and don't do a lot of these surgeries. So it's kind of all foreign to them.
Okay.
So it causes a big shebang.
So stay at least 2 weeks after after he's out of the hospital.
Yeah,
Okay.
that would be my recommendation.
Mhm.
Like I said, we have some patients who do go. We have one in New York. He came down and he went home, and like 3 days being home, he called me, sent him to Sloan. He lived by Sloan, to the ER. They shipped him down here, and he was here for a week and a half. In the hospital. He was miserable. I was like, you could have just stayed. Like,
Mhm.
so
That's good. Okay, we can
that's
do that.
my recommendation. But if you want to go home, go home. I mean, we definitely will work with you and get you what you need and do all that. But
Yep, we're ready to
We're
stay.
staying.
okay.
We're staying.
Someone's knocking.
Well, I will send Dana in to talk to you.
Thanks.
She'll give you tons of nitty gritty about diet stuff.
Okay.
Okay?
Alright.
Okay?
Thanks.
Well, you're welcome.
Nice
We'll
to
see
meet
soon.
you, Amy. Thanks for the
Nice to meet
briefing.
you guys. You're welcome. If you have any questions, I'll give you guys my card. You can call myself or Marie.
Great.
Okay?
Okay.
Thank
We'll
you.
get you squared away.
Thanks.
You're welcome.
Well, no Lovenox. That's a relief, because that's $100+ a day.
Yeah, I'm glad it didn't feel like yesterday like I tried.